Joining me right now is Susan Johnson, who's a spokesperson for the family of Willie, and Elizabeth Graham with the Texas Right to Life. Elizabeth and Susan, I want to welcome you both to Houston's Morning News. Let's talk a little bit about what happened to Willie. And Willie is a name that we're going to use for this particular patient. I want to play something here for you, Susan. I believe this is you speaking.
When they pulled the plug, he was breathing at 100% for almost 20 hours.
So we've got a situation where a hospital, and we now know it's a Houston Northwest Medical Center, pulled the plug here. Tell me exactly why Willie was in the hospital.
Oh, hi, Matt.
Hi, Susan.
He walked in the hospital about a month before this happened. He had pneumonia. And when they did the testing, they said he had also leukemia that they said that they were going to treat, and they treated it with chemo. When they did the chemo, it's normal for your body to go down when you have chemo.
Right.
It's very harsh. So he started having a little bit of heart problems, so the blood pressure problem. His blood pressure went down. They gave him medication for blood pressure, so that caused the kidneys to malfunction. And this went on for a couple of weeks, and his body was just really being attacked with chemo for he had several sessions. And then after 3 weeks, they told us, okay, we're going to be pulling the plug in 10 days.
Susan, hang on one second. Now, I want to grab Elizabeth Graham here. Elizabeth, good to have you on, as always. They contacted you. The family contacts you. There was a social worker apparently working on behalf of the family, but you say this social worker was doing more harm than good.
We followed up the calls that the social worker had made to the facilities. We asked the social worker, where have you called? Why was he turned down? Meaning, why could we not move Willie elsewhere? And I want to be clear that we understand Willie was quite ill. The family understood he was quite ill. No one was expecting medical miracles. We just wanted to move Willie to a more appropriate care setting so that he could heal or recover, or so that he could be comfortable and die naturally. No one was expecting Willie a miracle for him to completely turn around and walk out. We understand he was quite sick. But what happened is we wanted to move Willie to a different care setting. And so we asked the social worker what calls had been made, what she tried to do. And when we followed her footsteps, we actually had the administrator at a facility in South Texas say, you all need to move him. That lady making calls is acting like he's already dead. This is not good. You shouldn't leave him there. And we found that at more than one place that the social worker had really painted a horrific picture of Willie's prognosis.
Well,
and we knew, right. And so if she's calling and saying, we can't do anything, this guy's a mess, why would another facility want to take him?
All right, ladies, hang on. And again, I thank you both for talking about a very difficult situation. When we come back, I want to read you what we've received from the hospital. They did not want to come on with us, but they did give us a statement. Houston's Northwest Medical Center did give us a statement. In all fairness, I want to read that statement. We're joined by Susan Johnson, a spokesperson for the family of Willie. Also, Elizabeth Graham with the Texas Right to Life. We're talking about Willie plug pulled at Houston Northwest Medical Center by an ethics committee after they felt that he wasn't going to get any better. He wasn't moved. We invited the hospital on with us. They did send us this statement. Let me read this to you. At Houston Northwest Medical Center, we seek to provide the best and most appropriate care to each of our patients so that the most optimal outcome can be achieved. We understand that the end-of-life care decisions are difficult. The hospital has established a bioethics committee. It includes physicians, nurses, social workers, community at large members, pastoral care, and risk management. Committee was created to serve as an advocate for the patient while helping the families through these difficult decisions. The committee and the patient's attending physicians determined that there was no hope of his condition improving, and it was recommended that he be removed from life support. Based on the committee's determination that further treatment would be futile, the committee's recommendation to remove life support was carried out in accordance with state law. The family was included in this process. Again, we realize that this was a very difficult situation for the family, and our thoughts and prayers are with them. Susan, were you included in that process, as the hospital says?
You know, when they told us this, that they were going to pull the plug in 10 days, that was the first time we ever heard about such law. I mean, at the beginning, we were so shocked that we thought, no, they got to be kidding me. You know, there's no way that somebody would do that to you, especially because Willie was getting better. They're not telling the truth. He was getting better. He wasn't. He was breathing on his own an hour at a time without ventilator. And he also was not using dialysis anymore. When they did that to him with the chemo, he was on dialysis. And then towards the end, the last week, the whole week, his kidneys started working.
Elizabeth, excuse me, Susan. Elizabeth, so they took him off life support, and he basically starved and was dehydrated before he finally passed away. Is that right?
Exactly. That's exactly what they did to him. I was on the phone begging them. His daughter was on the phone, and right there, begging him, what is this that you're doing? He needs care. He needs to eat, because he was fine when they pulled the plug. He was fine. He was breathing on his own. 100%.
Elizabeth, let me ask just real quick, Susan. Excuse me, Elizabeth. Is this normal? I mean, is this something that normally takes place? Why wasn't he moved?
Texas Right to Life has helped about 60 families over the last couple of years, and I can only speak to the families who call us for help. We are frightened that many more families probably undergo this process and don't call us for help. And so this is normal, and generally we've found when we've attended ethics committee meetings with families that the people on the committee are generally those affiliated with the hospital, so clearly they have a conflict of interest. If the administrators are saying, you know, let's move this person on to Glory, there's a conflict because the doctors and hospitals generally are not going to oppose the administration or the bean counters. And what happens is that even if the facility or the doctors say that further care is futile, that is a quality of life judgment. Further care may be futile, but when a patient is ill, terminal, or has a terminal or irreversible condition, we do not speed the death. Those people are disabled, and we help them continue to live.
Elizabeth, ladies, I've got to just break here. I'm up against it at the top of the hour, but we will certainly continue to follow this story. And Susan, I want to thank you for the time. I know this is very difficult. My thoughts and prayers go out to your family, and we'll continue to watch this story. I want to thank you both for joining us here this morning.